Yo, what up, a-holes? It's your boy, Eric Levi, the Holistic A-Hole, coming at you here with a new video. Today, I want to talk about an article that recently came out in The Hill. It is titled, "Our Diets Are Killing Us, and Doctors Aren't Trained to Help." And that is basically the whole gist of the article right there. It's everything I've been talking about since day one of this whole Holistic A-Hole platform, which is this. We are responsible for our own health because all of the disease and all of the problems that are plaguing the healthcare system, most of them can be tied back to nutrition. And the problem is that doctors, they don't know about nutrition, which I know. It's like finding out that Santa Claus isn't real, especially if you're Jewish. I'm sitting there like, wait, Santa's not real? Then what's all those presents that I'm so jealous of everybody getting? Where are they coming from? Santa ain't real, and doctors don't know about nutrition, which is why doctors are going to give you pharmaceutical drugs every time you go to the doctor's office. Here's the problem. The problem is that nutrition accounts for so much of your health. I mean, basically, when we talk about chemicals and we talk about what nutrition is chemicals. It's information that you put in your body and your body reacts to it. And it does all this stuff. And for the most part, it keeps you alive. But for many people, over just long periods of time and throughout your life, you've just been constantly eating the wrong stuff. And not to say that there is like a right and wrong way, like a solid right and wrong way to eat, but there are definitely things that your body does good with, and there are definitely things that your body does not do good with. Perfect example. People eat, or when people cook, they cook with vegetable oil. And there could be no worse oil to heat on a pan, and for many people, that's a Teflon-coated pan. There's no worse combination than a Teflon-coated pan cooking and heating vegetable or canola oil. Because now what you've basically given yourself is a double shot of carcinogenic chemicals that you're going to add to whatever food you have, and maybe that food you have is like a good grass-fed burger, or maybe even some broccoli or some kale, and you add on some of these, carcinogenic chemicals that come from these two ingredients that were just used to cook with, and now you have a problem. And what I just told you right there is more than most doctors know about nutrition, which is pathetic. It's absolutely sad and pathetic that doctors aren't able to figure this out. Because the fact is medical school is expensive, and there really isn't time to teach doctors this. And that's what this article really, for the most part, breaks down, okay? So let's just go through it here. What if your doctor failed to talk to you about the most important threat to your health? Wouldn't you worry about the quality of your health care? Poor quality diet is a leading cause of death in the United States. But it is unlikely that your doctor has the knowledge to even begin a meaningful conversation about your nutrition or to make an appropriate dietary referral. Again, that's absolutely bonkers. So many people put all of their faith into the knowledge of their doctor. It's not your, it is your responsibility to take control of your body and to know the right and wrong things. But I can empathize with people not understanding, because there's so many stories and studies that come out every single year. I think every year there's over 100,000 nutritionally related studies that are published in journals, right? And so many of them are conflicting. One study will tell you that soy is good for you, and then one study will tell you that soy is bad for you. One study will tell you that meat is good for you. One study will tell you that meat is bad for you. So people, are just kind of living their lives, going about their days, going to work, coming home, watching the game. How do you have time to keep up with all this stuff? So you expect your doctor to know this, but here's the problem is your doctor doesn't know this, right? We read on. Most doctors lack knowledge necessary to offer nutrition advice to patients. Indeed, fewer than 14% of physicians report feeling equipped to advise on diet or the connection between food and health. This is unsurprising given that, for example, 90% of cardiologists in a recent survey reported receiving minimal or no instruction on nutrition during medical training. And here's an interesting paper that was published in the American Journal of Medicine talking about, nutrition education in the practice of cardiology. And it's a pretty long article, but we'll just jump down here to the abstract, which isn't the best practice, but you can kind of see what we're getting at here. A large proportion of cardiovascular specialists have received minimal education and training in nutrition, and current trainees continue to experience significant education and training gaps. So the guy who is responsible for your heart, your cardiologist, who is the one advising you on how to keep your heart healthy, and we know, the most effective way to keep your heart healthy is through your diet. All right. And now I'm not going to get into the minutia of, plant-based or meat diets or whatever diet. It doesn't matter. Okay. You can't be expected to follow a specific, fully structured diet. In fact, it's for the most part unnecessary if you just day by day take care of yourself. Crash diets are the worst, specialty diets for many people can be the worst because there's so little compliance among most people, right? So a good balanced diet full of meats, full of animal and plant products is really the best way to go. A nice spread of protein, carbohydrates, and fats. I know that triggered so many different people by saying that, but these are the facts. This is what if you don't want to polarize yourself with one diet over here or one diet over here, if you just follow a good balanced diet, you avoid garbage fried oils, you stay away from, refined flour and refined white sugar, you're going to be okay, right? But again, cardiologists, this isn't a part of their education. The education that doctors get in medical school does not equip them to be able to, to understand this. I believe it's, what is it? I've heard like less than 1% of the time spent in medical school. And we're talking, what do you spend in medical school? 8 to 10 years in medical school? Less than 1% of that time, I think it's a total of like 10 hours or 8 hours or something, some bonkers low number like that, is spent in nutrition education. And nutrition is the one thing, no matter what you do with your day, no matter what drugs you take, no matter what exercise you do, everybody gets nutrition. Everybody eats. Everybody drinks. How is this not being discussed in medical school? So, this article goes on here. And, it's also concerning obesity, type 2 diabetes, heart disease, cancer, and stroke, which are the leading causes of death in the United States, are all closely linked to diet and nutrition. No, duh. Nearly 40% of adults and 18% of children are obese. Can you wrap your head around that? 40% of adults, almost 1 in 2 adults is obese. That is a catastrophe. This is a full-on catastrophe. If you're not grasping the urgency of this problem, it's not, 40% of Americans are overweight. It's 40% of adults are obese, and 18% of children. That's basically 1 in 5 children is obese. That is not good. That is not good because what's going to happen is those 18% of kids are going to grow up to be obese adults, and their life expectancy is not going to be that long. Okay, and from the time they're kids to the time they die, which will probably be at a young age, they're going to need a lot of medical care. So this is what I always talk about when it comes to when it comes to why Medicare for all would be an absolutely catastrophic policy for this country, because it will, whatever the price tag that people like Bernie Sanders and AOC are putting on a Medicare for all deal, the real number is probably at least double, maybe triple, possibly even quadruple that number, because they're not taking into account this number right here. 18% of children are already obese. They're already obese. They've already got health problems. They're already on probably diabetes medication. They already have a hard time breathing. They already have a hard time walking. And as they get older, their bones are going to continue to crumble. They're going to continue to need more and more medication. And what's going to happen? They're going to go to their doctor. They're going to go to their doctor. And what's their doctor going to say? Sorry, Brian. Here's some Lexapro, though. That'll make you feel better. We're fucked. We're so screwed right now. This is why you need private insurance. This is why we need to completely diversify the private insurance market. Because, I mean, if Americans are being counted on to pay for this stuff, we are screwed. We go on. A focus on treatment rather than prevention has led to medical education that ignores the central role that food plays in health. The average U.S. medical school devotes less than 1% of total lecture hours to nutrition. Accreditation. How do you say that? Accreditation requirements for medical residencies and fellowships do not include nutrition. So again, these doctors, you know, they just don't. They're not equipped. They don't know. They just don't know that that food has anything to do with these problems. In fact, this is the problem with medical school and the problem with doctors is all the pharma companies have gotten in the medical schools. All the pharma companies are already in there. So when you're a doctor and somebody comes and sees you, you can't say, "Hey, you know what you got to do is you got to stop eating so much corn oil. You got to stop eating so much sugar." They go, "Well, you know what'll help? These pills." Because that's what they know. And they've made it so that not only can the doctor not just recommend nutritional solutions, the doctor can be sued if they don't prescribe medication. They can be sued for malpractice. That's how deep and problematic this issue is. So this dangerous gap in their education means that doctors do not learn the basic guidelines in the U.S. dietary guidelines for Americans, which is in itself pretty awful, or stay apprised of the latest nutrition science. Accordingly, they fail to recognize and are unable to convey to patients the importance of diet to health. This means fewer referrals to nutritionists, even when diet plays a vital role in a patient's health. And we know that nutrition plays the most pivotal role when it comes into things like chronic disease, autoimmune disease, diabetes. We know this. I mean, the studies are out there. The science is out there. This is not even debatable. We know that we can debate what diet is better, what foods are better, but what we cannot debate is, does diet play a major, if not the most major role into whether you are going to get sick or stay healthy. It's so pathetic. And here's the kicker right here. At its current rate, Medicare spending will exceed $1 trillion in the next 10 years, assuming that we don't give Medicare to everybody. Diet-related diseases account for 5 of the 8 most common conditions among Medicare beneficiaries. So it's clear that as the prevalence of diet-related diseases increase, healthcare spending increases. 5 of the 8 most common conditions. 5 of the 8 most common conditions that we're paying Medicare claims on are 100% diet-related. And again, you know, we could look at them. Diabetes, totally preventable with diet. Type 2 diabetes, I should say type 1, that's more genetic, but can be managed through diet. Autoimmune disease, heart disease, so many of the cancers that we have, you know, fucking rheumatoid arthritis, Alzheimer's disease, also known as type 3 diabetes, all all can be controlled and managed through diet. Doctors somehow don't know this shit. Fortunately, we can change this troubling status quo. Opportunities exist for policymakers at the state and federal level, as well as bodies responsible for testing and accreditation to make systemic changes to the medical training. And it just kind of goes on to just kind of talk about, here was where the Harvard Law School thing came in. So rather than spend a whole lot more on Medicare to treat diet-related diseases down the road, Congress should leverage this funding to require nutrition education for residents and fellows. These policies and others are explored in a recent report from the Harvard Food Law and Policy Clinic, which was actually what this was here. So, I mean, look, man. This is why I'm here right now. I know some of you don't like me. I know some of you love me. But the fact is, what I'm talking is the truth. I have no reason to spend my time just, talking about bullshit. I have no reason to just talk about the fucking Kardashians or, gender pronouns or even the wars, right? Or Russian collusion or whatever it is. This health issue, nutrition, is the most important issue that the younger generation has to deal with. And I'm talking about my generation. I'm talking about people older than me. I'm talking about the kids, the millennials, the Generation Ys, the teenagers, and the preteens, because somehow 18% of those kids are already obese. When I was a teenager, when I was 16 years old, there was like a handful of fat kids. That was it. I couldn't imagine being in school right now and 1 in 5 of my classmates being not overweight, not with little tummy tums, but giant fucking monsters of human beings. And look, I'm not saying that we need to go back and fat shame these people. A lot of these people, it's not their fault. There's this idea known as the generational response or the transgenerational response, which means that basically, we are all shittier copies of the previous generation. So when you think about it, processed food has only really been around for about 100 years or so. So, our great-grandparents, my grandparents, my great-grandparents, the first generation of my family that came into this country, they started eating, the fucking Wonder Bread and the canned foods, but it didn't really affect them that bad. But then my parents, they got some of the shittier copy genes from my grandparents. But again, doesn't affect them that bad. Now, my generation, this is where we start to see the effect of the third generation eating shit food starting to come up with all of these chronic diseases like skin problems, gut problems, brain problems, diabetes, all of these. And if you have diabetes, your kid is, I don't know what the exact number is, but it's like 30 or 50 or 70% likely to have diabetes, right? Or to have cancer, or to have whatever the disease is that you have. So if we don't turn this around, the next generation who gets born into the next decade or the next few decades might completely, I would even be willing to go as far as to say, will definitely collapse our entire economy. All because doctors have no idea about nutrition. Nobody knows how to talk about nutrition. The one person that you go to for your health and you spend a lot of money on to give you advice on how to deal with your health is not even equipped to talk to you about nutrition. So let me know what you think in the comments below. Let me know what your thoughts are. I know this is a very hot topic, especially if we start talking about things like Medicare for All. Are you in favor for Medicare for All? And if you are, I would love to know what your solution to this very problem is. How would you address this? Would you start implementing mandatory nutrition education in schools? And if you would, how would you account for taking away time for other doctoral duties, time in residency, whatever it is that would take the place, that nutrition education would take the place of? Let me know what you think link in the comments. Also, remember to subscribe to the channel and share this video anywhere you can. Thanks so much for watching, everybody. I'll catch you on the next vid. Peace.